Topic for this month is diabetes, type 1 diabetes in particular. This has affected me personally through my daughter. My oldest daughter has type 1 diabetes, and in a little bit she's going to share with you what it's like for her. Let me explain what type 1 diabetes really is, though. It is an autoimmune disorder that causes your body to stop making insulin. Insulin is what we need to break down the sugars and the glucose that we get from when we ingest food. So this is our energy source. When you don't have insulin, it can't break down that glucose and use it for energy. Unfortunately, you have no nutrients, you have no fuel that's going in your body. So for us, when Callista was first diagnosed, she was extremely thin and very weak.
Hello, my name is Callista Schmidt, and I'm Mrs. Schmidt's daughter. And when I first found out that I had diabetes, it was about 5 years ago after my team and I just won a state tournament. And I was really sick and really dehydrated, and I was drinking a lot of liquids. And I wasn't feeling the best, and I couldn't eat a lot, and I was just always thirsty. And so we went to the doctor, and that's when we found out that I was diagnosed with type 1 diabetes. This has changed my life a lot because my friends and not a lot of people know about it and what you have to do to stay healthy and keep up with the illness. It's changed me a lot because I've realized that there's a lot worse things than just having diabetes. Like, it could be way worse. Also, I realized that keeping up with my diabetes is way harder than I thought, and it's way harder than everyone thinks, and it's just a lot of work. I have to check my levels, so I'll check how much sugar is in my levels every time I eat, so about 3 to 5 times a day. And that's really hard because at school, no one else knows what it's like, and they're always like, what are you doing? And they think it's super weird and stuff. But that's a challenge. And then my sites, they get infected sometimes if I keep them in too long. And that's a big challenge because I just went on another antibiotic to help that out because I just had an infection. And also, with sports, it's really hard to have my levels at a good spot because if my levels aren't at a good level, then I don't play as well or perform as well, and that can affect not just me but my team also. So this diabetes have not only affected me but my family and my teammates.
In my system.
Okay, so right now I'll be checking my sugar levels. Draw a little blood and then put it in your test strip. I have to do this about 3 to 5 times a day every time I eat, before or after. So my level was about 230, and they're supposed to be from 80 to 120. So if I'm over, I have to grab my pump and I have to plug in whatever it was that I was at. And then my pump is smart enough, I'm lucky to have a pump because it's smart enough to know how many units it has to put in. So there's like a ratio that goes in, and then it'll say like how many units is going to go into your system. And that's called a bolus. And then what it does is it stands right here and it connects to the side of my back, and the medicine goes through the tube into the site and into my body, and that helps my sugar levels. And if I'm really high, sometimes it get really high, if it's after sports and I haven't checked in a while, then I have to check after too, like after it's been in for a while, so I know that my levels are actually going down. Also, when I play sports, my levels will go down or up, so you never know, because with activity and when you're sleeping, they go down, and if they're lower than 80, then you have to eat sugar, so they go back up. Because if they're too low, I could pass out and it could get really bad. But if my levels get too high, then I'm not at my best performance, and I sometimes get really crabby, and it's really different. Like, I'm not myself when I'm really high. So I want to keep it at a medium, from 80 to 120. Also, when I play sports, I have to hit suspend, so I act, and then down arrow, and then there's a suspend button, and then I can just unclick this, and it'll go out. So my pump and my cord right here will all be separated, and this, my tube and my sight thing, just stays in my back. So I can play sports and stuff. But I can't keep it out for too long, because otherwise my levels will get, they'll jump all over the place. They'll get lower or higher, which is not good, like I explained before. Also, with having my pump in all day long, it has like a basal rate, and the basal rate puts in medicine during the day because my body already isn't producing enough insulin for the amount of sugar that your body like produces even without eating. So my basal rate just puts in insulin so my body can say the same thing without eating food. Then with eating food or exercise or sleeping, I have to put in extra and calculate all of that. I'd say the worst part would be people not knowing how hard it is, and also keeping up with it during school, during activities, and also trying to like be a normal kid. One thing I wish everyone would know is that people with diabetes need the help and support. And sometimes your friends don't understand, but my friends are really good about it. And they help me, and they always are like, Callie, did you check your levels? Or Callie, make sure you do this before we play and stuff. So they're helping me make sure that I'm on, and they're helping themselves because I'm part of their team. Make sure that they always are like on their A game. They're always checking their levels, and they're always are good. And make sure you give them major support and just help them whenever they need it.
Arrow in there. It's going to point the direction you want this lead to aim when you're done. Little grippies on the side for your fingers to grab so you can pull it out. Clicks on both sides of it. And when you go to put it in, you're going to push here, these two.
And the needle.
Needle goes in. The needle's got this cover on. You take off before you put it on her, obviously.
Can't really see the needle except for like that. Well, yeah, let's sort of see the thing.
So pull it out. Clicks. Arrow to direction you want to aim. You alright on this side, or you still got the infected?
I can do it higher.
Where about do you want? Would you want it?
Right here.
Right there. Push the arrow to the front. Push the two sides in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull it out. And then lightly just push down on the padding.
It has a little tube that is connected to her insulin pump. There's insulin in her pump, which feeds through the tube into her back.
Needles here now.
There's a small dose that's called the basal dose. The basal that goes in all the time, or pretty regularly in small amounts. And then there's a bolus amount that she needs to plug in whenever she eats something, because when she eats, that increases her sugar levels dramatically. So she wears this on her hip. Let's see, and you can see it sometimes. In some outfits, you can't see it at all. You want to lift up your shirt again and show it again? There. And she just attaches it right there to her pants. And it's a pretty complicated little machine. It does all the calculations for her too.
What you just saw was Callista getting her insulin pump set up. We have to do that every 3 to 4 days, and it's a little needle that pokes into her body and stays there, but it's connected to the tube that goes to her pump that feeds the insulin into her body on a regular basis, and also when she tells it to give her extra when she's eating. This has been a dream because before she got the pump, she had to inject herself with a needle, a shot, every time she wanted to eat or when she checked her sugar levels by picking her finger, and she would find out that her levels were extremely high. That would mean there's too much sugar in her body. Some of the long-term effects of this with diabetes would be problems with your kidneys, losing your eyesight. Some people even lose limbs if they don't take care of themselves and keep those sugar levels where they need to be. What Callista doesn't tell you is that it's a very nerve-wracking process, especially as a parent, because you're constantly worrying about her. There is a lot of research out there right now that they are, through stem cells, they're creating insulin-producing cells that they're injecting into pancreases. So the good news is, hopefully either she would be a candidate for a pancreas transplant, or they'll be able to create these cells that we could inject into her. But the problem is she needs to stay healthy, so she's a candidate so that she qualifies to get this medical help in the future. That's something as a child she doesn't quite always do. So she runs extremely high often, which puts a lot of wear and tear in her body. When she is extremely high, like she said, she is crabby and she's not herself, and she's actually a lot more tired. When she's really low, it's scary because she gets shaky, her eyesight is very blurry, and in fact her speech is slurred too. So she almost sounds as if she's intoxicated. And then that could lead into a diabetic coma, which we would definitely have to call 911 right away, and it could lead to even more serious complications. So diabetes is getting better every day with new research and medical help.